Assalamualaikum dan hi everyone. My name is Nur Izzati binti Ibrahim. Matric number is F56806. We will present the case study for in the subject STM 4201. Okay, next. Okay, the table of content have four. The number one is clinical sign of malnutrition. The second is potential effect of cancer and its treatment on a patient nutritional status. Three is nutrition care process, and the last one is meal plan and dietary strategies. Okay, next. Okay, the case study that our group got was about the female patient. The name is Jean. A mother of four, which is diagnosed with stage 2 colon cancer. So Jane's current weight is 51 kilogram and Jane height is 158 centimeter. So after calculate the BMI reading, the BMI status for Jane is normal, which is a 20.4. Based on the Jane's hemoglobin reading is 11.6. This is Jane's hemoglobin reading is low because the appropriate reading for women is 12.3 until 15.3 gram. Okay, next. So I made a conclusion for clinical sign in a table. So the body symptom is Jane have a mouth dry and mucous membrane. The symptom of condition is dyspepsia. Description of condition is dyspepsia is difficulty or inability to swallow normally or to transfer liquid or solid food from the oval cavity to the stomach. The consequence is Jane will have a loss of appetite, weight loss, and malnutrition. So the sign of malnutrition is macro and micronutrient deficiency, and the possible causes is colon cancer. I will pass the presentation to my friends.
Hello everyone, my name is Nur Afrika binti Sabrin. So I will continue our presentation, which is potential impact treatment on cancer patient. So the side effect of chemotherapy was vomiting, loss of appetite, hair loss, anemia, memory impairment, and deteriorations of skin and knees. For the sign and symptom of the colon cancer was trouble going to the bedroom, blood in stools, abdominal pain, loss of appetite, and unexplained tiredness. For the next slides. So, potential effect of cancer was malnutrition, 14 calorie malnutrition, significant weight loss, anorexia, sarcopenia, cachexia. Next. For the treatment of cancer patient was a chemotherapy. So the chemotherapy, the side effect was anemia, fatigue, hair loss, change in smell and taste. For the next immunotherapy, side effect were fatigue, chills, fever, and decreased food intake. For the radiation therapy, side effect was loss of appetite, skin change, and fatigue. For the surgery, side effect was fatigue, loss of appetite, and pain. For the next slide, I will pass to my friends. Thank you.
Okay, I will continue to present. My name is Nur Atika Adlina. I will present about a nutrition care process for patient to prepare her for the surgery. Next. For the documentation style, we use ADIM, which is A for anthropometry, D diagnosis, I intervention, M monitoring and evaluations. For the anthropometry, the patient age is 55 years old and her initial weight is 56 kilogram. The current weight is 51 kilogram. The height is 158 cm. And then for the patient's initial BMI, which is she had 22.43, which is normal BMI, and for the current BMI is 20.43, which is her BMI is still in normal BMI. And then the energy requirement she needs daily is 1991.5 kilocalorie per day. The formulation is Harris Benedict. Next. In terms of biochemical, the patient's hemoglobin is 11.6, which is Jane have a mild anemia because the level of the hemoglobin is lower than the normal hemoglobin, which is 12.1 to 15.1. And then for the albumin, Jane have a normal albumin reading which is within the 3.4 and 5.4 GDL. Next. For clinical, she had a disease diagnosed with stage 2 colon cancer, and then she have symptoms like weight loss, with loss of appetite and dysphagia, which is 3 months before being diagnosed to colon cancer stage 2. And then she have a low calorie intake, which is 1,311.3 kilocalorie per day, based on her diet history. She might consume high sugary intake, which is she take sugar, creamer, and muffin. And then for physical signs such as dry mucous membranes of the mouth have likely exacerbate her dysphagia. And then she also given birth to 4 children. And then for the 3 weeks later, she will undergo the chemotherapy within 12 cycle follow-ups. Next. For her dietary, she consumed high caffeine intake, low fruit and vegetables intake, and inadequate fiber intake. Next. For the diagnosis, first one, dehydration related to inadequate beverage intake as evidenced by patient's diet history and dysphagia. And then for the second one, weight loss related to inadequate food intake as evidence as lost appetite and dysphagia. For the third one, stage 2 colon cancer related to inadequate fiber intake as evidenced by patient's diet and dysphagia. For the fourth one is she's having a mild anemia related to inadequate iron intake as evidenced by Jane's hemoglobin result. Next. For the intervention, based on diagnosis 1, dehydration, patient will be given liquid food or fruit juice, which is 8 to 10 glasses a day to rehydrate the body fluid. Then patient will be given soft touch food to stimulate saliva and drink through the straw. And then for the based on second diagnosis, during hospitalization, Jane will maintain her current weight as she's still in normal range BMI. Then modification of her diet include adequate calories and nutrition dense food to prevent further weight loss, which is leads to underweight. Next. Based on diagnosis 3, the patient will be given fiber-dense food to prevent progressive infection to the intestine. The patient will be given a nutrient-dense food as the patient will undergo chemotherapy. And then based on diagnosis 4, which is mild anemia, The patient will be given green leafy vegetables and source of nuts and legumes to help treat iron deficiency anemia. Next. For the monitoring and evaluation, for the first one, um, we need to train Jane to monitoring weight herself daily and keep log to maintain her BMI in normal range. For the second one, patient need to avoid red meat and processed meat like hot dogs, and then she need to choose lean protein like eggs, fish, and poultry instead. Then she need to have a good plant-based sources of protein like lentils, legumes, and nuts. And then, or maybe roguish or fiber because it is fibrous in this digestible material part of plant-based foods that aid the passage of food through the intestines. And then the third one is take into account how well patient able to chew and swallow. And then for the last one is to have it clean out of the colon. Patient is recommend to have a clear liquid diet for 12 to 24 hours before patient surgery. Like example of food she can take is like a broth and clear fruit juice. And then that's all. Next, I will pass to the next presenter.
Hi everyone, my name is Guan Junwen. I will continue the presentation to explain how to design a meal plan for Jane. To design a specific diet for Jane, we need to first calculate the energy requirement, protein requirement, calculate carbohydrate requirement, and also fat requirement for Jane. So as my friend said before, in this case, we are using Harris-Benedict formula to calculate the energy requirement. By using the formula, we will first calculate REE, which we just put Jane, weight, height, and age into the formula. After calculate, the REE for Jane is 1,178.4 kilocalorie. For energy requirement, we need to multiply the REE with activity factors and also injury factors. Because Jane will undergo colectomy next 3 weeks, so we choose 1.3 for the activity factors and also 1.3 for the injury factor. After calculate, the energy requirement for Jane is 1,991.5 kilocalorie per day. For protein requirement, Jane will in hypercatabolism condition next 3 weeks, hence she should take protein in between 1.2 to 1.6 gram per kilogram. In this case, we choose 1.6 because the cancer patients are recommended to take high protein energy food. So after multiplying 1.6 with 51 kilogram, is same as 82 grams of protein, or 60% from the total energy requirement. For carbohydrate, we choose 55%, which also same as 274 grams for carbohydrate per day. For fat requirement, we choose 29% from the total energy requirement. After multiplying, Jane should take 64 grams of fat per day. By using this result, we have calculated food exchange for the food item by using the food distribution table. After calculating adjustment, in the meal plan for Jane, it should consist of 2 exchange of milk, 2 exchange of fruit, 6 exchange of cereal, 1 exchange of legumes, 3 exchange of vegetable, 1 exchange of fish, 1 exchange of meat and poultry, and also 9 exchange of fat. For the meal plan, it consists of 53.7% of carbohydrate, 15.7% of protein, and also 27.4% of fat. We assign to put 1 exchange of milk at breakfast and also at supper. For fruit, we put 1 exchange at lunchtime and also 1 exchange at dinner time. For cereal, we put 1 exchange at breakfast time, 1.5 exchange at morning tea, 1.5 exchange at lunch, 1 exchange at afternoon snack, and also 1 exchange at dinner time. For legumes, we put 1 exchange at supper. For vegetable, we put 2 exchange at lunchtime and also 1 exchange at dinner time. For meat or poultry, one exchange was put at the dinner time for Jen. And for fish, one exchange was put at lunchtime. And lastly, for fat, 2 exchange at breakfast time, 2 exchange at morning tea, 2 exchange for lunch, 1 exchange for afternoon snack, and also 2 exchange for dinner. By using the meal plan table, this is a meal plan we designed for Jen. Because Jen is facing problem difficult swallowing food and drinks, so the food item we choose actually is more easy for her to swallowing. By referring this meal plan, Jen should take 1 glass of low-fat milk, 4 small grapes, 2 cups of plain rice porridge, 2 eggs, avocado at her breakfast time. For morning tea time, she should take 2 slices of wholemeal bread, 2 teaspoons of butter, half cup of steamed sweet potato. For lunchtime, Jen should take 1 slice of watermelon, 2 cups of cooked white rice, 1 whole steamed mashed potato, 1 cup stir-fried broccoli, 1 medium steamed yellow strip scallop, 2 teaspoons of olive oil, and also 1 glass of plain water. For afternoon snack, she should take 6 pieces of biscuit and also 2 tablespoons of light cream cheese. For dinner time, Jen should take 1 whole banana amass, 2 cups of plain rice porridge, half cup of stir-fried bok choy, 1 pieces of steamed chicken drumstick, 2 teaspoons of olive oil, and also 1 glass of plain water. For supper, we suggest Jen to take 1 glass of low-fat milk and also 1 cup of boiled chickpeas. And next, I will pass to our next presenter.
Okay, my name is Nur Nabila Binti Cernadun and I will continue for this part, which is dietary strategy in managing cancer side effects. First, fiber and lactose is advisable to reduce side effects as bloating, abdominal pain, and also diarrhea. Next, Jen can eat in a small amount of food, but more frequently meat and snacks. Third, Jane needs to avoid eating raw and undercooked food such as unwashed fruit and vegetables to prevent food poisoning. Next, Jane can avoid making food too spicy and salty. Next is increased protein intake, which is sourced from lean protein, seafish, and also small amount of egg. Next. For the side effect of symptom anorexia, so Jane can eat nutrition-dense meal and snack frequently. And next, drink nutrient-dense beverage between meal to avoid feeling too full with the meal. Nutrient-dense ni adalah milk, which is a very affordable source and essential nutrition like protein, and also have calcium, phosphorus, vitamin A, D, B12, B2, and B3, and also B5. Next, for xerostomia, Jane can try soft and moist food which is extra soft and also dressy. Next, Jane can rinse the mouth frequently with baking soda solution, which is 1 tablespoon of baking soda and 1 quart of water. Next, for the taste changes, Jane can also marinate the fish with spices to mask the strength of and taste, but Jane need to avoid too spicy. Next, for the eat fresh and also frozen food rather than canned. Next. For the symptom dysphagia, Jane needs to follow instructions regarding diet consistency and swallowing technique provided by speech pathologist. And also, Jane can eat soft, moist, and puri food to avoid chunking, soup, and also stew. Next, for the mucositis, try to sucking popsicle and ice it before eating to stimulate swallowing reflex. Next, and this is our references, and that's all from our group. Thank you.